welcome the growing pains because ultimately no one has this figured out yet. And as me and Leo are talking, every institution is different. So again, mindsets and culture is very different, and you have to be mindful of that. But governance is becoming another buzzword because ultimately more onus is being put on the hospital systems themselves to determine how can AI be effectively deployed, monitoring for bias, data drift, and ensuring that the patient safety is kept at the forefront. So we've been going through our own process in which we've had our own imaging AI committee locally at Jefferson Einstein, and has also scaled up to the entire enterprise. So Jefferson Einstein was one ecosystem. Well, now we have, over a dozen different hospitals within our systems. And that means that when looking at AI, you really need to think about something that is agnostic and can work well no matter the hospital system department. But layered on top of it now with the advent of generative AI solutions, now we have an even larger enterprise AI steering committee, which is an umbrella organization now dealing with the entire healthcare system across all different specialties. A lot of demands, a lot of needs, a lot of people that want to start using AI yesterday, but they don't know where to start. So where we are in this process is ultimately, let's gather all of the appropriate stakeholders, legal, IT, C-suite, clinician leaders and champions within each of the departments, and bringing them all to the table. And where we are now is we're ultimately saying, okay, we are at an enterprise level. Let's start putting pen to paper of what is important to us and what we are ensuring that every AI commercially or in-house works within these guidelines. It's important to create these guardrails. Especially, I would like to highlight just section 1557 of the ACA is important because now it's saying that we as the enterprise healthcare system, we're responsible for ensuring that these AI solutions work well and they don't fall off to the wayside. So it's first and foremost making sure that we actually create the guardrails, but now it's like, okay, how do we now figure out what existing AI solutions we've had across the enterprise, figure out which ones are scalable and which ones aren't, and then of course now monitoring the cost of it all. Because there are partnerships and agreements that one hospital may have with one group, but ultimately you have to figure out, can that vendor handle this entire healthcare system? And then can we afford it, or can we trust that they will be able to work with all these different systems? These are all conversations we're having constantly because it requires us to sort of first start at the grassroots level, gather all of the appropriate intakes, see where we are currently at in our AI landscape, and then start funneling them through a more regulated process to figure out what is actually going to be a long-term fit versus ones that will have to eventually sunset.